I'd like to welcome Dr. Delia Cortés Guiral to our American College of Surgeons series, speaking with surgeons from around the world on their experiences with the COVID-19 pandemic. Dr. Cortés Guiral is trained in both colorectal surgery and in surgical oncology and is well known around the world for her work with peritoneal surface malignancies with HIPEC and PPEC. She's working in both Spain and Saudi Arabia. So I'd like to touch on a couple of unique aspects of her practice and how COVID-19 has impacted it. Welcome, Dr. Cortés Guiral.
Thank you so much, Professor Stephen Wexner. It's really a pleasure to be here with all of you.
So firstly, I know you've had some personal experiences slightly outside of the medical realm because of having a practice in both Saudi Arabia and in Madrid. Maybe you can tell us a little about some of the anxiety and challenges getting home to your 6-year-old son from Saudi Arabia on the last flight out.
Yeah, it was really a stressful day. I have to leave Saudi Arabia. The same day they closed the borders to the rest of the world. Saudi Arabia has been very, very strict since the beginning of the outbreak. So a few days, just like 10 days ago, they decided to close the borders of Saudi Arabia to the rest of the world. And I have to left. I'm working in both hospitals from King Khaled in Saudi Arabia and in Madrid. But I decided that during the pandemic, I wanted to be with my son, who's living in Madrid. And so living in Saudi Arabia was really stressful. They just closed the borders. A lot of people who was not able to buy a ticket to live is now stuck in Saudi Arabia. There's no possibility to go back or to leave Saudi Arabia. And I don't know when I could go back. But yes, it was pretty stressful. I had to fly. I took, in fact, the last flight to London, and then from London to Madrid. But I was pretty lucky.
So you have a perspective on how the pandemic was managed in two very different countries. Maybe you could tell us how it was handled and what was the result of the way it was handled, at least within the healthcare system and the surgery departments.
Yes, I think I've been very lucky. I could see, and I have a very different perspective from the measurements and all the things that the government of Saudi Arabia decided to do very early since the beginning of the outbreak. They canceled all the flights from or to China. They canceled all the flights to countries with a huge number of COVID cases. They also closed the Mecca, and they canceled all social events. And even though they canceled domestic flights. So they took a lot of measures very, very early, and I think it worked very well. In fact, when I left Saudi Arabia, there was no single case of COVID in my city, and now they have around 1,000 cases of in all the country. On the other hand, when I arrived to Madrid, and as you know, Madrid is right now in a very bad situation. We have surpassed China in the number of cases, which now is more than 94,000 cases of people infected in Spain, with a very high rate of mortality. Unfortunately, in Spain, with the highest rate of healthcare workers infected people, around 13% of people infected in Spain are healthcare workers, so it's a very bad record. And yes, in Madrid, on the other hand, and in Spain, the government has not made this type of measures. There were a lot of social events that were not canceled. There didn't cancel flights, and we have there's a nightmare here now in Spain.
So as we talk about you're going back to your hospital in Madrid and the nightmare there, here you've trained in 2 separate fellowships, surgical oncology and colorectal surgery. You're highly specialized in what you do, so much so that you're sought after in 2 places. But I don't suppose that's your practice now. I don't suppose you're doing elective HIPEC and PPEC. You're probably in a different role. So can you tell us how that's being handled in your hospital and in Madrid?
Yes, when I left the week I left Saudi Arabia, I was doing I did the 2 cases of HIPAC, FIPAC, and then I arrived to Madrid, where all elective surgeries have been cancelled, as well as oncologic surgeries. Most of them, all of them have been cancelled. The problem in Madrid, we have no beds of ICU. And ICU units in Madrid are completely collapsed. There are no ventilators, no respirators. So we don't have the chance to do any oncologic surgery. My activity right now as a surgeon in Madrid is just to be prepared for emergent surgeries. We try to do no surgery at all, as mortality is really, really high, especially for COVID patients. We always try to do conservative management. And for most of the surgeons in Spain, they are moved to the white plan, and they are working now at the medical board treating COVID patients. As well, our surgical residents, most of them, they are working at the ICU units. And just a small part of surgeons, we are still working as surgeons, but only for emergency cases.
So you began to retrain. At what point did retraining or cross-training occur? Was it in anticipation of a surge of patients, or was it during the surge of patients?
Sorry?
At what point did surgeons start relearning other skills like intensive care and emergency department, accident and emergency casualty department skills? Was that during the surge, or were some measures taken prior to the surge to
At all. I think there has been no anticipation. It's been completely during the surge. And I think most of us, we are doing our best and the best we can, learning from our medical colleagues. In fact, here in Spain, there are no specialties now. All of the medical specialties, oncologists, digestive, rheumatologists, allergists, all of them, they are treating COVID. And all of us, we are learning at the same time to deal with diseases.
Would you have any advice for us here in the United States if we're not yet in a surge? Should we be focusing, while we're not doing elective surgery, on relearning our other skills like intensive care and pulmonary medicine?
Yes, I think that one of the best advices and the best lessons you can learn from Spain, unfortunately, is first to take care very well of the healthcare workers. We have so many of us now infected and at home, or even though admitted at hospital, some of our doctors and colleagues intubated or they have death. Second, I think it's very important that it's true, we have to learn at least how to deal with the virus to protect ourselves, about personal protection. But also what you were learning what you were asking me, I think we have to learn some skills. It depends on where we need us. At the ICU, we really need to deal and to deal with the ventilators and with some drugs. But the most important is just as general recommendations to have this patient with very low volumes of intravenous fluid, to have our patients with a very high oxygen supply. We have to monitor transferrin levels because it's an early marker of poor prognosis, as it determines macrophagic activation. We have to be aware of the platelets level, and we have seen a lot of patients, and it's very dangerous at the post-operative time, that they develop like a kind of antiphospholipid syndrome, and with very low levels of platelets, and at the same time that start to develop a lot of population problems with thromboembolism. So we have to deal with all of this, and it's very challenging because in our general practice our patients don't behave like that, so we have to learn and to study a lot about this.
That's excellent clinical information. Thank you. So you spoke about healthcare workers being at risk. What protection do you take? Do you wear full, or which personal protective equipment do you wear, and what setting do you wear it? The whole time you're at work, only when you're operating on known positive patients? Explain that a little bit.
Now in Spain, and especially in Madrid, And there's no visitors at the hospital, and no relatives can go inside the hospital, only hospital personnel. As soon as you come into the hospital, you have to wear your gloves and your mask. And also it's recommended to wear your glasses or a visor at least. If you are at your office, this is what you have to wear. This is the minimum. If you go to the ward to see any patient or to the emergency department or even to the OR, you have to wear your personal protection equipment, your complete suit, and you have to wear your glasses, and over that your visor. And you have to protect completely yourself and to wear at least 2 pairs of gloves. And this is all the time you're in the hospital.
Is there adequate supply of equipment to go around, or do you have to, guard your own equipment that you're given and reuse it or somehow clean it?
I'm going to be very honest about it. The first week when I arrived in Madrid, we didn't have enough equipment, so we have to reuse our mask for 2 or 3 days. Now, lucky as 2 days ago, we received a lot of material. In fact, until 2 days ago, we didn't have personal protection equipment. We didn't have the complete suit that were used in China and in other countries. And I think this has been one of the reasons why we have such a high rate of personal infection.
So the last question is, you're taking precautions now with PPE. You now have enough. Before this, you didn't necessarily have enough, but you're transitioning. You're working in the hospital for a long period of time. I know in an earlier discussion, you told me last week you worked over 90 hours in the hospital.
Yeah.
96 hours, I think, was the number last week, which is a lot of time to work in the hospital. So you're in this environment with so many patients. In fact, what percent of your hospital do you think are COVID positive patients now?
Right now, around 70% of our patients at hospital are COVID positive patients.
So you're now coming home to your 6-year-old, who it's very nice to hear him playing in the background during our interview. I enjoy that humanistic aspect of our interview. But how do you protect him? Are you required to be COVID tested before you leave? Tell us some of the steps that we can learn in the United States. How do we best protect our families when we leave the hospital and come home?
Yes, I think we have to be very, very strict if we want to protect our families. It's very important that you always wear the same shoes when you go to the hospital, and as soon as you get home, you have to take off your shoes, leave them out of the house. You have to take off your clothes as soon as you get the home, put them in a bag just to wash them at very high temperature, like 60 degrees Celsius. And you also have to take a shower as soon as you get home, wash your hair, and you have to be very, very careful with all the stuff you take to the hospital and then you take back to the home, like your mobile phone or your keys, or this type of things. Before you go inside your house, you have to clean all of them with a special solution, with alcoholic solution or something. And it's very important to protect our family. That's the reason why it's so important for us to wear gloves all the time when we are at the hospital, and to clean up all our personal stuff when we go back home. It's very important.
How about actual COVID testing for healthcare workers? Under what circumstances do you get tested?
Yes, right now in Madrid, you are tested if you have any symptom of COVID, just coughing, just fever, just headache. You are tested. If you have any dangerous contact, for example, you have been in touch with the patient and you were not wearing all the PPE, you are tested. If you have been with any of your colleagues in very close contact and finally he is positive, you are also tested. And for me, at the end of this 96 hours before going back home with my family, yesterday I was tested, and like me, I was negative.
Well, we're delighted to know that you're negative and that you're home with your son, enjoying some well-deserved rest after doing this unbelievable service for your community. Like to again thank you for participating in our American College of Surgeons interview series with surgeons in Frontline, and wish you and your family sustained health and safety throughout this pandemic. We look forward to seeing you in person when it's all behind us in the future.
Thank you so much. Thank you for this opportunity. All the best for the United States. Congratulations on this initiative. I think it's so humble and so smart from you to do this, to try to learn from the mistakes we have made in other countries. And for sure, I wish all the best for the United States.
Thank you.
Thank you so much.